A nonprofit in Carlsbad is helping reshape the faces and lives of children here and around the world. Fresh Start offers free reconstructive surgery for those with deformities, as well as accident and abuse victims. Dwane Brown spoke with a plastic surgeon who has made a commitment to helping those youngsters.
Plastic surgery, or cosmetic plastic surgery, is something we think about for the rich and famous, or baby boomers, or older adults who want a little nip and tuck. But you have worked on children for quite a while. What picture comes to mind when you think about a child you helped get a fresh start?
Well, probably one of the most remarkable patient experiences I've had has been with a young lady at Rady Children's, Natalia H., let's call her for privacy's sake. Natalia was about 16 years old and was born with a very unusual clefting syndrome. Not what you think of as a little cleft lip, but in utero, as she was developing, there are these bands that sometimes form in the amniotic fluid, and they literally just slice through fetal tissue. So she was left with, say, one eye that was missing, and a half a nose, and a lip that was cut through. So a very, very serious and very deforming condition. She had had probably 40 operations by the time I met her, and we really did a more definitive operation, bringing her eyes together, rebuilding her nose, moving her jaws. But before she has surgery, what she does is she has us turn all the lights off in the operating room except for the main lights. And she puts on an Aztec dance. And she then kneels by the operating room table, says a prayer for everyone in the room, including herself, hops up on the table, and the lights go back on and she goes to sleep. And it's almost magical to watch this and kind of imagine almost this slow motion dance that she does just before she says her prayer. And I guess people like Natalie are the kinds of reasons that I like to be involved in treating children and young adults and adults that have severe deformities.
Now, I've seen some of the before and after pictures, and people often judge each other based on what they look like. Why is it important that these young people who have not only deformities but maybe have been abused as a child, why is it so important that they get help?
Well, virtually 95% of these children have normal brain function. They're normal kids. The way society responds to a horrendous defect, however, and it's not society's fault. We abhor, something that is, that sad looking or that deformed. So I think, in large measure, these children are striving just to become accepted parts of society. They're striving to be treated, normally rather than shied away from. They want to be talked to the same way you and I want to be talked to.
Dr. Cohen, I'm also fascinated by the fact that not only are you a surgeon, but you're an artist, a painter and a sculptor. How do you see art intersecting with surgery?
Well, I made a good choice as a plastic surgeon, so it intersects on a daily basis. For me, it's very natural as an artist because I look at it, with an artistic eye. If it looks proportional, if it's in balance, those are the things that we see. So, as an artist, I often respond more to, those nuances rather than, mathematical formulas.
The program Fresh Start serves about 1,300 children a year.
Yes.
Donates up to $1 million worth of surgeries.
Yes.
How much does a typical surgery cost, and how long does a patient spend in the program?
Once we incorporate them as a patient, they're seen on a regular basis. They're flown back to San Diego on a regular basis, and they're treated the same way a child in the United States with insurance would be treated. And then in terms of cost, these procedures can range from operations that if they were in the hospital and in an intensive care unit for a couple days, they could range, in price from, say, $50,000, $60,000, $100,000, maybe down to, $5,000 for a more minor outpatient procedure.
Why are you so committed?
Well, I'm committed to these children because, you know, making them happy, improving their lives, improves my life, makes me happy. You know, when you see a child blossom because they're more comfortable with their appearance and they're better accepted among their peers, you know, it's hard to get a better feeling than that. I just don't see anything that would be better than that type of charity.
Dr. Stephen Cohen heads the Craniofacial Center at Rady Children's Hospital. It now has 800 surgeries a year, regardless of families' ability to pay.